Diuretics help the kidneys remove sodium and water from the body, reducing blood volume and lowering blood pressure. There are 3 main types of diuretics: thiazide, loop, and potassium-sparing. Thiazide diuretics include hydrochlorothiazide and Chlorthalidone. Loop diuretics include Furosemide and Bumetanide. Potassium-sparing diuretics include Spironolactone and Eplerenone. Beta blockers reduce blood pressure by blocking the effects of epinephrine, also known as adrenaline. This action slows the heart rate and decreases the force of heart contractions. There are 2 types of beta blockers: non-selective and cardioselective. Non-selective beta blockers include Propranolol and Nadolol, while cardioselective beta blockers include Metoprolol and Atenolol. ACE inhibitors, or Angiotensin-Converting enzyme inhibitors, prevent the formation of angiotensin-2, a substance that narrows blood vessels. By inhibiting this enzyme, ACE inhibitors help to lower blood pressure. Common examples of ACE inhibitors include Enalapril, Lisinopril, and Ramipril. Angiotensin-2 receptor blockers, or ARBs, block the action of angiotensin-2 by preventing it from binding to its receptors. This action relaxes blood vessels and lowers blood pressure. Examples of ARBs include losartan, valsartan, and telmisartan. Calcium channel blockers prevent calcium from entering the cells of the heart and blood vessel walls. This leads to relaxed blood vessels and lower blood pressure. There are 2 types of calcium channel blockers: dihydropyridines and non-dihydropyridines. Dihydropyridines include amlodipine and nifedipine, while non-dihydropyridines include verapamil and diltiazem. Alpha blockers reduce blood pressure by blocking alpha-adrenergic receptors, which relaxes blood vessels. Common alpha blockers include doxazosin, prazosin, and terazosin. These medications are often used in combination with other antihypertensive drugs for better efficacy. Central agonists act on the central nervous system to lower blood pressure. They work by decreasing the signals that speed up the heart and constrict blood vessels. Examples of central agonists include clonidine and methyl-dopa. These drugs are typically used when other antihypertensive medications are not effective. Direct vasodilators act directly on the blood vessels, causing them to relax and widen, which lowers blood pressure. Common direct vasodilators include hydralazine and minoxidil. These medications are often used in combination with other antihypertensive drugs to enhance their effectiveness. Renin inhibitors block the activity of renin, an enzyme involved in the production of angiotensin first, which eventually becomes angiotensin-2. By inhibiting renin, these drugs help to lower blood pressure. An example of a renin inhibitor is aliskiren. Combination drugs combine 2 or more antihypertensive agents to increase effectiveness and improve compliance. These medications are particularly useful for patients who need multiple drugs to control their blood pressure. Examples include Lisinopril with hydrochlorothiazide and amlodipine with benazepril. Each combination is tailored to target different mechanisms of action for optimal results.